Hi, my name is Derwin Tallman. I'm working in Dr. Zane Kalpi's laboratory researching on the AED drone and PulsePoint app. My starting question is, how would the two technologies be beneficial for rural Native American reservations within the United States? The main purpose of an AED drone is to decrease the risk of anyone who is in a cardiac arrest from having a higher chance of not being able to survive. From this, its expectations are exceeded through the PulsePoint app that helps create the life-saving duo to be portable, safe, affordable, and easy to set up anywhere. AED drones are known for its quick response time to sudden cardiac arrest events that are unfortunately impossible to predict. So the way the PulsePoint app works is by keeping track of portable AEDs that are in the area, as well as people who are CPR qualified, and provide streaming audio of the emergency responders' radio traffic. This way things can go by a lot smoother and organized for anyone who has the free app downloaded. The AED drone decreases the time it takes for an AED to help sudden cardiac arrest patients compared with EMS response times. According to the American Heart Association, it's estimated that 356,000 deaths occur each year in the United States due to cardiac arrests. The chance of a person surviving an out-of-hospital cardiac arrest without the use of an AED is 1 in 10. This being said, the importance of saving a person going through cardiac arrest relies on how early the affected person gets CPR or defibrillation before it's too late. Meaning time is of the essence when contributing to a life-saving program. In most cases, there are usually AEDs set up on walls, usually in airports, casinos, and large public venues because of known delays in EMS arrivals, due to a number of differentiating factors. Things such as distance and traffic are a few of many factors that hold up EMS arrival. The AED drone is easy to control and lightweight for effective pickup when it reaches the location of the sudden cardiac arrest patient. What the PulsePoint app also does is notify people that there is a life-saving assistance needed that involves the pickup and use of an AED drone, or if the person in cardiac arrest needs high-quality CPR while help arrives. Which brings up the idea of using the AED drone and PulsePoint app on Native American reservations. There are many different tribal reservations that mostly don't have much land, but large tribes such as the Navajo Nation have a large area to cover, with hundreds of thousands of people. The problem is the mobile app requires some sort of connection to download and run the app with a phone via internet or cellular data signal, which not everyone has on the reservation. For the ones who have access might not be so close to the out-of-hospital cardiac arrests. So the goal is to get more people to have the app, the more the better connection with the potential out-of-hospital cardiac arrests. With the rough unpaved roads that branch off from the paved roads, the EMS struggle against time, especially when their call has to deal with a sudden cardiac arrest patient. And the usual distance from the nearest hospital is so far from the out-of-hospital cardiac arrest patient, the odds of pulling through are not so great. Although both the AED drone and PulsePoint app go hand in hand, the potential lack of internet connection would devastate the accuracy. The benefits of using the AED drone and PulsePoint app would enable the time it takes to travel through the terrain to being a lot faster for an out-of-hospital cardiac arrest to receive an AED. This crucial setback would have to be dealt with through some sort of deal with phone companies to get more reliable signal strength for dead zones. Because the Navajo Nation is self-governed, the process of getting the AED drone and PulsePoint app out there for the people's benefit could be a lot less complicated. Depending on how the Navajo Nation government fully understands the potential significance of this life-saving technological advancement, there could be the possibility they would have these set up across the reservation without the hassle of bringing the money together ourselves, the people. Based on the research on the AED drone and PulsePoint app, my ending questions are: how would citizens react for the first time when an AED drone arrives? Will there be any controversy and resolution over the idea on how this idea would be funded? Will any new regulations arise from this idea depending on the native reservation laws? Could there be a potential alternative for other technological efforts besides the mobile app?